Imagine this. You feel fine, maybe a little tired, a bit short of breath at times, but nothing serious. Then, out of nowhere, a heart attack strikes. No warning, no obvious symptoms, just a life-threatening emergency that changes everything. Unfortunately, this isn't rare. Studies show that nearly half of all heart attacks occur without prior warning signs, catching people completely off guard. Even more alarming, atherosclerosis, plaque buildup in the arteries, starts decades before symptoms appear, silently restricting blood flow until one day it's too late. Heart disease remains the leading cause of death worldwide, responsible for 1 in every 5 deaths in the US alone. The scariest part? Many of these deaths could have been prevented if the early, subtle signs of artery blockages had been recognized and addressed in time. But here's the crucial part. Your body often gives you warnings long before a heart attack happens. The problem is that most people ignore them because they don't recognize the signs. That's why today, we're exposing the silent symptoms of clogged arteries that you absolutely cannot afford to overlook. Some of these might surprise you, but knowing them could save your life or the life of someone you love. But first, if you think this information could help others, give this video a like, subscribe, and share it with anyone who needs to hear this. Now, let's dive in. How do arteries get clogged without you knowing? Most people think heart disease is sudden. It isn't. In reality, artery blockages develop slowly over decades without causing noticeable symptoms. It all starts with inflammation and tiny injuries to the artery walls, often triggered by poor diet, high blood pressure, smoking, and even chronic stress. In response, the body tries to patch up these injuries by sending cholesterol to the site. Over time, these fatty deposits, called plaques, build up inside the arteries, causing them to narrow and stiffen, reducing blood flow. At first, your body adapts to these changes. It might create new pathways for blood to flow around the blockages, allowing you to feel completely fine. But as plaques grow, blood circulation becomes more restricted, depriving vital organs, especially the heart and brain, of the oxygen they need. Eventually, if a plaque ruptures, it can trigger a blood clot that completely blocks an artery, leading to a heart attack or stroke in an instant. And here's the scariest part. By the time noticeable symptoms appear, the blockage is often already severe. That's why recognizing the early hidden warning signs is crucial. It's your best chance to act before an emergency strikes. Now, let's uncover the silent signs that your arteries might be in danger. Chest pain is one of the most alarming and widely recognized signs of heart trouble, but it doesn't always look the way we expect. Many people associate severe, crushing chest pain with a heart attack, but it can also present as mild discomfort, tightness, or a sensation of pressure, which might be dismissed as indigestion or stress. However, this could be an indication that there's an underlying blockage in your coronary arteries. When plaque builds up inside the arteries, it restricts blood flow, causing the heart to work harder to pump blood. This can result in angina, a condition where chest pain occurs due to the heart not getting enough oxygen-rich blood. Angina can happen during physical activity or even at rest, and it's a clear sign that the heart is not receiving the nutrients it needs to function properly. While chest pain is often associated with serious cardiac events, it's important to recognize that it can be a silent, progressive issue, worsening over time without obvious warning signs. It's crucial not to ignore even mild discomfort, as this can be an early warning of a more severe problem down the road, such as a heart attack or other cardiovascular events. If you're experiencing chest discomfort, don't wait for it to escalate. Seeking medical advice could save your life. Pain in the jaw, neck, or back is often overlooked, especially since these areas aren't typically associated with heart health. But when it comes to artery blockages, this type of discomfort is one that should not be ignored. This pain can be a signal that your heart isn't receiving the blood and oxygen it needs due to narrowed or blocked arteries. The reason for this pain is related to the concept of referred pain. Referred pain occurs when the brain interprets pain signals from one area of the body as coming from another. In the case of heart problems, the heart's inability to get adequate oxygen causes discomfort that radiates outward, often affecting the jaw, neck, or back. This can be a precursor to a heart attack, especially when the pain is sharp, sudden, or intense. For example, one study published in the European Heart Journal found that jaw pain, particularly on the left side, is a significant warning sign for an impending heart attack. It's a red flag that indicates the heart muscle is being deprived of oxygen due to a blockage, which is why the body tries to signal distress in areas far from the chest. If you notice persistent or unusual pain in these areas, it's essential to seek medical attention as soon as possible. Early intervention can make a major difference in preventing serious heart events. Pain or numbness in the legs is another symptom that often goes unnoticed, but it can be a crucial sign of artery blockages, specifically in the lower extremities. This happens when the arteries that supply blood to the legs become narrowed or blocked due to atherosclerosis, which restricts blood flow and oxygen to the muscles and tissues in the legs. One common manifestation of this reduced blood flow is intermittent claudication, which refers to pain or cramping in the legs during physical activity. This occurs because the muscles in the legs, especially during exercise, are not receiving enough oxygen due to restricted blood flow. The pain typically subsides after resting, but it can return with any exertion. Even more concerning is when the numbness or pain is persistent and it's not relieved by rest. In severe cases, it could be an indicator of peripheral artery disease, a condition where plaque buildup in the arteries has caused significant blockage and it's preventing proper circulation. The American Heart Association notes that PAD affects approximately 8 million people in the United States, with leg pain and numbness being some of the earliest and most common warning signs. If you experience leg pain or numbness that doesn't seem to go away, especially during physical activity, it's critical to get checked by a healthcare provider. Ignoring these symptoms can lead to more severe complications, including the risk of a heart attack or stroke. Cold or pale skin. If you notice that your skin feels unusually cold or looks pale, especially in your arms or legs, it could be a significant warning sign of reduced blood flow due to artery blockages. When the arteries become clogged with plaque, circulation to various parts of the body can be severely compromised. The lack of proper blood flow prevents oxygen and nutrients from reaching the skin, causing it to appear pale and feel cold to the touch. This happens because the constriction in the blood vessels reduces the volume of warm blood circulating near the surface of the skin. This is particularly noticeable in the extremities, like your hands, feet, arms, and legs, where the blood flow may be restricted. Cold or pale skin can indicate that your tissues aren't getting enough oxygen and nutrients, which are crucial for maintaining healthy skin and organ function. If you begin noticing persistent coldness or paleness in your skin, especially along with other symptoms like pain, numbness, or weakness, it's a clear indication that you should seek medical attention immediately. This could be an early warning sign that your arteries are becoming blocked and may be putting you at risk for much more serious cardiovascular events. Unexplained fatigue. Fatigue is something that we all experience from time to time, whether from stress, lack of sleep, or overexertion. However, when fatigue becomes persistent and unexplained, it could be a silent signal that something more serious is going on, especially when it comes to heart health. When your arteries are blocked or narrowed due to plaque buildup, your heart has to work harder to pump blood throughout the body. This increased effort can result in a drop in energy levels, as your heart struggles to supply the body with the oxygen and nutrients it needs. The reduced circulation means that less oxygen reaches your muscles and organs, which leads to feelings of exhaustion, even after relatively simple activities. A study published in the Journal of the American College of Cardiology reveals that fatigue is a common, often overlooked symptom of coronary artery disease. In fact, 50% of people with CAD report feeling unusually tired, sometimes for months before any obvious symptoms like chest pain or shortness of breath appear. This fatigue is particularly noticeable during physical exertion, but can also happen during periods of rest, making it harder to pinpoint the exact cause. It's important to pay attention to fatigue that doesn't seem to have a clear origin, especially if it's associated with other signs like chest discomfort, dizziness, or shortness of breath. If you experience unexplained fatigue regularly, it's essential to see a doctor for evaluation, as it could be your body's subtle way of signaling that your arteries are becoming blocked, placing you at risk for heart attack or stroke. Dizziness or lightheadedness might seem like just a minor inconvenience, but it can actually be a warning sign of a more serious problem, particularly when it's related to blocked arteries. When plaque builds up in your arteries, restricting blood flow, it can affect the oxygen and nutrients reaching the brain, leading to symptoms like dizziness, lightheadedness, or even fainting. The brain is highly sensitive to changes in blood flow. If the heart struggles to pump blood effectively due to blocked arteries, it can lead to a temporary drop in blood pressure, which in turn causes dizziness. Studies have shown that when the blood supply to the brain is reduced, it can trigger a cascade of symptoms, including nausea, dizziness, and fainting spells. One study in the Journal of the American Heart Association found that people with arterial blockages are more likely to experience dizziness or vertigo, especially when standing up quickly. The less efficient circulation means that less blood is delivered to the brain, leaving you feeling lightheaded or disoriented. Experiencing dizziness or lightheadedness regularly, particularly if it happens when you stand up or after physical exertion, is a signal from your body that something might be wrong with your circulatory system. If left unchecked, this could eventually lead to more serious consequences, such as a stroke or heart attack. If you've been noticing these symptoms, it's crucial to seek medical attention immediately. Your doctor can perform tests to determine if artery blockages or other cardiovascular issues are causing these episodes and can offer treatment to prevent further complications. Swelling in the lower extremities, particularly in the legs, ankles, or feet, might seem like a minor issue or just a result of standing for too long. However, it can be a silent sign that your arteries are not functioning properly and that blood circulation is impaired. When arteries are blocked, the flow of blood from the heart becomes less efficient, leading to fluid retention in the lower parts of the body due to poor circulation. This swelling, known as edema, occurs because the blood struggles to return to the heart. As blood flow slows down due to arterial blockages, pressure builds up in the veins, causing fluid to leak into the surrounding tissue. The result? Swelling that can be noticed especially in the feet, ankles, or legs. A study published in Circulation found that leg swelling is one of the early signs of peripheral artery disease. PAD is commonly linked to plaque buildup in the arteries and is a serious condition that can lead to severe complications, including the risk of amputation. Swelling in the legs or feet, especially when accompanied by pain, cramping, or a feeling of heaviness, should not be ignored. If this becomes a recurring problem, it may signal a need for medical attention to assess the health of your arteries and prevent potential heart problems from escalating. If you notice swelling that does not go away, or if it gets worse over time, it's time to consult with a healthcare provider to explore the underlying causes and get treatment that can improve circulation and prevent further complications. Slow healing wounds. We all experience minor cuts or abrasions from time to time, but most of us expect them to heal relatively quickly. However, when you notice that a wound takes longer than usual to heal, it may be more than just a minor inconvenience. Slow healing wounds can be an early indicator of poor circulation and reduced blood flow, often due to blocked or narrowed arteries. Your blood vessels play a vital role in carrying oxygen and nutrients to your tissues, promoting healing and recovery. When arteries become clogged with plaque or fatty deposits, the blood flow to the affected areas is restricted. As a result, the necessary nutrients and oxygen needed for wound healing can't reach the damaged tissues effectively. This delayed healing process can lead to an increased risk of infection and complications. Research published in the Journal of Clinical Investigation found that poor circulation is a major contributor to slower wound healing, particularly in patients with atherosclerosis or peripheral artery disease. If you notice that minor cuts, scratches, or sores take much longer to heal than they should, it's important not to ignore this symptom. It could be an early warning sign that your arteries are becoming blocked, and addressing this issue early on can help prevent more serious cardiovascular problems from developing. Consult a healthcare professional if you're experiencing delayed healing of wounds, grayish or bluish skin, cyanosis. One of the most alarming signs that your body may be struggling with arterial blockages is a noticeable change in the color of your skin, particularly a grayish or bluish tint. This condition, known as cyanosis, occurs when oxygenated blood is not reaching your extremities as efficiently as it should. It's often most visible on your lips, fingertips, or toes, but can also affect other areas of your skin. Cyanosis happens when blood flow is impaired due to narrowed or blocked arteries, causing oxygen-rich blood to fail in circulating properly throughout the body. As a result, skin may appear dull or take on a bluish hue. Research from the Journal of Vascular Surgery emphasizes that this occurs when blood oxygen levels drop below a certain threshold, often seen in individuals with peripheral artery disease. Left untreated, this can lead to severe complications, including tissue damage or even loss of the affected limbs. Cyanosis is a serious and urgent warning that your arteries and circulation may not be functioning properly. If you notice any change in skin color, especially alongside other symptoms like chest pain or shortness of breath, it's crucial to seek immediate medical attention. Ignoring it could be risking your health in a potentially life-threatening situation. Recognizing these silent signs of artery blockages is crucial for preventing serious cardiovascular events like heart attacks or strokes. Your body can be sending you signals long before you even realize there's a problem, and catching these signs early can be life-saving. If you notice any of the symptoms we've discussed, it's important to seek medical attention and take proactive steps to protect your heart and overall health. Now, if you found this information helpful, please give it a like, subscribe for more content like this, and share it with someone who might benefit and make your heart a priority today. See you in the next video.